everybody, I am Dr. Sunny Singhal. I am a geriatrician from the Department of Geriatric Medicine at All India Institute of Medical Sciences, AIIMS, New Delhi. Today, I am going to provide a brief introduction and overview of geriatric care, that is care for the older people. One of the most important measures of how civilized we are is how we treat the senior citizens of our society. To discuss elderly care, which is a growing challenge in India, we will discuss this module, and in this module, we will first understand what is aging and what are the various terms related to it. We will then understand how older people are different from the younger adults and what is the need and role of specialist doctors and caregivers for them. So, let us understand what is aging. In simple words, aging is the process of becoming older. However, old age is not a disease, but a normal, universal and an inevitable biological phenomena. Being older does not mean just increase in our years of age. It means accumulation of harmful changes in our body, thus causing a decrease in our physiological fitness. This in turn leads to increased risk of illness and death. Old age is the period of decline of the physical and psychological functions. It is a dynamic process which brings about physical and mental changes as well as a change in social status. The process cannot be stopped or reversed, but it can be delayed by helping aged people in maintaining healthy lifestyles. The problems of senior citizens are not entirely due to aging, but to an extent due to psychological environments, diminishing support and change in life situations. So, what is the official age definition of an older adult? Though the definition of an older adult varies from country to country, it is mostly defined at a cutoff of 60 or 65 years, depending on the retirement age of the country. In India, people above the age of 60 years are referred to as older adults according to the retirement age of the country. They can be further subdivided into three categories according to the age groups: young old, which is 60 to 69 years of age; old, 70 to 79 years of age; and oldest old, which is 80 years and above. In recent years, there has been a significant shift of focus and policy towards older people's needs and care. To understand the reason of this shift, we will have to first learn the concept of population aging. Population aging refers to an increase in the median age of population with time. With improvement in health and medical care, there is an increase in the life expectancy and decrease in the fertility rate of a population. As a result, there is an increase in the number and proportion of older people. Population aging can be seen widespread across the world. In fact, in some countries, more than 20% of the population is geriatric. For example, Japan has 28%, while Italy has around 23% population in the older age group. Though the aging of population is seen mostly in highly developed countries, it is now also being seen rapidly in developing countries too. India is also undergoing similar demographic shift, resulting in increasing number and proportion of older people in India. Now, these figures show the population pyramids of our country in 1950, 2019 and the expected population structure in 2050. As can be seen from the figures, the Indian population in 1950 primarily composed of children and younger population. However, with the passage of time and the improvement of medical facilities, the proportion of younger people, especially children, have decreased. On the other hand, the ratio of older population has been steadily increasing. While the median age of Indians in 1950 was 21.3 years, it has now increased to 28.4 years and is expected to further increase to 38.1 years by 2050. This increase in median age is known as population aging. Now, this figure shows how the 60 plus population in India has increased over the years and what is the expected growth rate in the future. As we can see, there has been an exponential growth of the older adults since 2010, which will continue at least 2060. The share of older population has increased from 5.3% in 1950 to 9.7% in 2019 and is projected to increase to 19% by 2050. By the end of the century, they will constitute nearly 34%, that is more than one third of the total population of the country. Now, this is a state-wise percentage of older population as per 2011 census of India. The prevalence varies from state to state, from 6.5% in Assam to 12.3% in Kerala. This increase in aging population of the world has led to a call for concerted global action for healthy aging. In response, World Health Organization (WHO) has declared 2020 to 2030 as a decade of healthy aging to bring government agencies, NGOs and other stakeholders together to formulate a plan to improve lives of older people. So, let us talk about two rapidly evolving fields in India: geriatric medicine and gerontology. Both these specialties have gained significant importance in the recent years. Geriatric medicine or geriatrics is a branch of medicine which specializes in the treatment of older people. It aims to promote health by preventing and treating diseases and disabilities in older adults. The doctors who study geriatrics, like myself, are known as geriatricians. Gerontology refers to the study of aging itself. It includes studying physical, mental and social changes in people as they age, investigating the effect of our aging population on society and applying this knowledge to policies and programs. People who study gerontology are known as gerontologists, and they can include researchers, practitioners from various fields including medicine, nursing, criminology, social work, physical, occupational therapy, psychology, sociology, economics, political science, architecture, geography, public health, housing, and even anthropology. Hence, both the fields are involved with addressing issues related to aging process, but while geriatricians provide immediate care for older adults, gerontologists are focused on studying the aging process in general. So, the question arises, why there is a need of separate specialty and trained personnel for elderly care, and why caring for them is different from that of younger people. The challenges faced by elderly people are multidimensional, include physical, psychological, social and economic aspects. The physical disability owing to diseases such as arthritis, vision loss, hearing loss, muscle weakness, stroke, Parkinson, heart disease, asthma, etc. Psychological issues such as dementia, depression, anxiety and other behavioral abnormalities. Social challenges include isolation, elder abuse, discrimination, etc. Economic challenges include financial insecurity arising from lack of source of income and increased expenditure such as health expenses. So, how are older people different? How are they different from the younger people? There are a lot of differences when we compare the older people with those who are younger or in the middle ages. Let us try to understand how. First, there is a decrease in physiological reserve. As I discussed earlier, as we grow older, there is a decrease in physiological fitness in our body. Thus, our bodies become increasingly more susceptible to any stressor. It can be related to any infection, trauma or even medication. For example, a common cold in a younger individual may cause fever, body ache, appetite loss, which can be treated with most of the cold remedies, but same illness in an elderly people may cause havoc. Poor appetite may cause significant dehydration and lead to dizziness and falls, especially if they are on blood pressure medication. Being bedridden even for a day or two will make an elderly noticeably weaker, again leading to falls. Increased disease burden. With increase in our age, there is also an increase in the number of diseases, especially non-communicable diseases like diabetes, hypertension and so on and so forth. For example, approximately 60% of all cancers and 70% of all cancer related mortality occur in persons aged 65 years and above. Most older people have more than one disease. This is known as multimorbidity, and the concept of multimorbidity is very important as treatment for one condition may interfere with another or in some instances make it even worse. The third point, atypical presentation of diseases. Similar to how diseases have different presentation in pediatric or children, diseases may have different presentation in elderly. To give a few examples, classical symptoms of heart attack such as chest pain, sense of impending doom, dyspnea are rarely present in elderly. Instead, they may complain of stomach ache, nausea or simply feeling tired. Cough, breathlessness and fever, which are the hallmarks of pneumonia, may not be even presenting features in elderly. They may simply manifest as poor appetite, fatigability and confusion. So, each older person is different, and we have to understand that each and every person is individual is different. Though all older adults have some decrease in physiological reserve as they grow old, the rate and amount of decrease varies from individual to individual. This measure of decrease of physiological reserve is known as frailty, and now this is one of the reasons that you will find that some of the individuals who are in the 60s are bedbound, while some in the 80s are running and even winning a marathon. Next is polypharmacy. So, it is not uncommon to see an elderly individual to take 5 or more medicines per day. As we grow old, the number of diseases and disabilities go on adding up. In many cases, it is necessary to take multiple medicines for these conditions. But as we grow old, the functioning of our organ systems, especially the liver and kidney, decreases. They are not able to metabolize medicines as compared to younger age group. Also, multiple drugs when taken together may even cause major side effects. For example, a typical 70-year-old gentleman with diabetes, high blood pressure, cholesterol problems, with heart failure will be taking at least 5 or 6 medications. Some of these medicines will lead to increased urination also, which can then cause urinary incontinence for the patient, which will then lead to prescription for new drug, which may have an additional side effect. Additionally, repeated going to the bathroom also can put him at the risk of slippage and fall, leading to hip fracture. Besides the side effect, there is a potential risk of mix up or even missing of drug doses due to forgetfulness, which can further complicate the patient's condition. Next is vaccination. So, like children, older people also have a high risk of getting infection, especially pneumonia. Hence, regular vaccination is recommended for them and has been being advocated by even Indian government. Increased functional dependence. Disability can be due to physical causes such as stroke, arthritis, etc., or cognitive causes such as dementia or a combination of both. Disability can make them functionally dependent on others for various activities of daily living. They may require other people's help for activities ranging from traveling, cooking, housekeeping to even basic activities such as going to toilet, eating, dressing, etc. Then there are geriatric syndromes. Besides the common health problems, there are certain conditions which are seen more frequently and more severely among the older population. These problems or conditions are often known as geriatric syndromes or geriatric giants. Common examples are urinary incontinence, falls, dementia, delirium, immobility, etc. There is also higher outpatient visits and hospitalizations. As older adults have several diseases and are taking various medications, they need to visit regularly to a doctor for follow-up and treatment of new health issues. Similarly, they are more likely and frequently to be hospitalized due to diseases such as severe infection, cancer, fall-related hip fractures, altered sensorium, etc. This is particularly difficult for them, especially if they are physically or financially dependent on others. Then there is a financial insecurity. Most older adults do not have any source or means of adequate income. They are unlikely to find any good paying job either due to their retirement age or due to their physical or psychological disabilities. Further, their healthcare expenses put an additional financial burden on them. As a result, more than half of the aged people are poor and financially dependent on others. Elder abuse. The high dependence of elderly on others for physical, emotional and financial support makes them vulnerable to elder abuse. It is an intentional act by a family member or any other caregiver causing harm or risk of harm to them. In a survey done in 2018, nearly 25% of the older people reported that they have been a victim of elder abuse in some form or another. This abuse may range from disrespect, verbal abuse or neglect to across physical or sexual abuse. Social discrimination, which is similar to elder abuse, older people also face discrimination and stigma in the society. This discrimination, often known as ageism, is quite prevalent and often remain unnoticed to other younger people. For example, it is still considered taboo for two old widowers to get married. They are often subjected to various stereotypes such as they are worthless, useless to the society. Similarly, they are considered inflexible, stubborn, even mentally unstable. They are often avoided in social functions and social situations and are frequently joked about. This social discrimination is quite demotivating, depressive and can cause suicidal tendencies among the older people. So, the question is, what is the need of geriatricians and how are geriatricians different from your normal physician and what do they do differently? First and the most important thing, that they add life to years and not years to life. Geriatricians aim to improve quality of life rather than just increasing the number of years. They recognize the importance of maintaining functional independence in older people and focus on providing targeted preventive interventions. They are specifically trained in the normal and abnormal physiological and psychological changes associated with aging and recognize the differences in presentation of disease relative to normal aging. They provide comprehensive medical care to all the health issues in the elderly, whether it is poorly controlled diabetes, blood pressure problems, joint pain, dementia or balance problems or Parkinson's, urinary problems, etc. They also further provide vaccination, routine and regular vaccination to the older adults. They evaluate and optimize the elderly person's medical state who are to undergo surgery by performing a pre-operative comprehensive geriatric assessment and at the same time take care of any post-operative medical problems that may arise in such patients. Geriatricians play a big role in early rehabilitation and discharge in such cases. They are experts in optimizing or decreasing the number of medicines taken by elderly and thereby preventing any side effects. Considering the special needs of our older adults and the gap in the geriatric care in our country, the Government of India decided to build two national centers of aging, one in All India Institute of Medical Science, AIIMS Delhi, which is a 200-bedded hospital, and a similar one in Madras Medical College, MMC, Chennai. These centers are specialized hospitals to cater the health and rehabilitation needs of our older population and are expected to operationalize by the next year. Here is a brief overview of one of the national centers of aging.
देश में आबादी की आयु में वृद्धि हुई है। बढ़ते वृद्धजन की संख्या को उच्चतम स्वास्थ्य सेवा प्रदान करने के लिए भारत सरकार द्वारा राष्ट्रीय वृद्धजन स्वास्थ्य सेवा योजना बनाई गई है, जिसके अंतर्गत एम्स नई दिल्ली में नेशनल सेंटर फॉर एजिंग की स्थापना की जा रही है। इस सेंटर के कुछ मुख्य लक्ष्य हैं: जैविक और सामाजिक जेरोंटोलॉजी और पोस्ट डॉक्टरेट पाठ्यक्रमों की शुरुआत करना तथा वृद्धावस्था विज्ञान में अनुसंधान करना, समुदाय के फॉलोअप रोगियों की देखभाल करने के लिए आउटरीच कार्यक्रम विकसित करना। कुल 200 जनरल वार्ड बेड्स की क्षमता वाले इस केंद्र के 20 आईसीयू बेड्स, 10 प्री ऑपरेटिव बेड्स और 15 पोस्ट ऑपरेटिव आईसीयू बेड्स होंगे। कुल 330 करोड़ रुपए की लागत वाली इस परियोजना का निर्माण वर्ष 2020 तक किया जाएगा। दिल्ली में एम्स स्थित नेशनल सेंटर फॉर एजिंग, जिसका शिलान्यास भारत के माननीय प्रधानमंत्री श्री नरेंद्र मोदी जी के कर कमलों द्वारा किया जा रहा है, अपने आप में एक मल्टी स्पेशलिटी स्वास्थ्य केंद्र हो।
So now question is, what is the need of geriatric caregiver and who is a geriatric caregiver? A geriatric caregiver is anyone or someone who understands and helps in fulfilling the special needs of older people. In our country, usually the caregiver is a spouse or another family member such as son or daughter-in-law. However, with the increasing trend of nuclear families, several older people are living alone without proper support and hence are in need of a formal caregiver. Though anyone can be a geriatric caregiver, it is necessary to have an appropriate person as older people have special needs. It is essential for a geriatric caregiver to be a good listener, have patience, and any inappropriate caregiver not only is not able to provide proper care to them, but also can even end up in abusing or neglecting them, thus further increasing their problems. This kind of abuse, known as elder abuse, is an extremely dangerous and poorly recognized social evil and would be explained in detail in a later module. The roles and responsibilities of geriatric caregiver varies according to older person's need and can be quite wide, such as assisting with personal care, bathing, dressing and toileting, preparing meals, shopkeeping, housekeeping, laundry, etc., maintaining general health care, giving medicines, reminding doctor's appointment, managing blood pressure, blood sugar, helping to get in and out of wheelchair or better shower, driving to and from activities, keeping general supervision, providing emotional support, being a stable companion and supporter in all matters personal, health related and emotional, handle crisis or any medical emergency, further to provide a backup caregiving, providing other caregivers a break. So, let us understand the rights of an elderly patient. In order to gain the confidence of an elderly person, the caregiver must understand their needs and comfort. The caregiver must also accept that the patient has the right to disagree or seek change in the care you give. He or she must also be aware of the rights of the patient and always remain committed to guard them. These are the rights of the elderly person which should be respected by the caregiver: right to respect, right to access of care, right to privacy, right to refusal of treatment, right to consent, right to transfer and right to continuity of care, right to complaint. So, let us talk about caregiver burnout. Taking care of senior citizen is a difficult job, especially caring for someone with special needs. This can cause physical and emotional exhaustion, and many caregivers experience symptoms which are consistent with depression. Overwhelmed with their responsibilities, many caregivers forget to take time for themselves, which can lead to caregiver burnout. Caregiver burnout is hard to predict because no two caregiving roles are the same. However, it is important to identify and address these issues. To create awareness regarding the well-being of elderly and also to appreciate their contribution, 1st October of every year is celebrated as International Day of Older Persons. Now, I will tell you some real examples and cases from our OPD. This first case is a case of a 79-year-old widowed lady who is a retired school teacher, lives alone in a flat in Delhi. She has a son and a daughter. Her son is currently a software engineer in US and daughter is also studying in US. She has diabetes, hypertension, for which she is taking medicine. She has decreased vision because of diabetes and age-related hearing loss. She also has severe arthritis, joint pain in her knees, thus making it difficult for her to stand or even walk for a long period of time. She also has now started to develop forgetfulness. Her physical disability coupled with her early onset dementia has caused her difficulty to get around to the market to buy essential food items for herself such as food and medicines. She also had difficulty managing her money, remembering to take medicines and visiting even doctor. Further, there is no one to check her regular blood sugar and blood pressure. Due to her poor vision, she had slipped twice in her bathroom, once from the stairs and leading to a hip fracture. She is also not able to visit her neighbors and family members much, thus further increasing her loneliness and increasing her depression and difficulty in sleep. The lady is otherwise educated, financially stable, though her blood reports might be normal, but her health is not. She is in need of a comprehensive geriatric assessment or CGA. Her issues should be carefully evaluated, understood and then resolved. First, she requires a caregiver not only to help her in daily needs such as shopping and cooking, but also someone who can remind her about the medicines and assist her in visiting doctor. Her home also needs to be assessed. The bathroom and halls should be well lit. There should be railings on the staircase for support, and the bathroom should have a western style toilet with handles so she can get up easily. Her doctor needs to change her medicines so that her sugar and blood pressure can be in control with as minimum medicines as possible. Her doctor should also prescribe appropriate pain medicines and regular physiotherapy for joint pain. She needs counseling and possible medication for her depression and insomnia. She needs to be evaluated for forgetfulness and be prescribed mental exercises to prevent further decline. For vision and hearing, she needs to be referred to an appropriate specialist. Let us take in another case. This is a 67-year-old couple who lives in a house in Kanpur. The husband is a retired pensioner who with a pension of 8,000 per month. The husband suffered from diabetes, hypothyroidism and backache, while wife has hypertension and a past history of stroke. They have a son who is married currently, living in the same town but in a separate house. He is an alcoholic and hence a failed businessman. He collects his father's pension and beat them regularly to force them to sell their home to get money and then stay at an old age home. Unaware of their legal rights and afraid of being socially boycotted, they tolerate it daily. The couple is now depressed, afraid for their lives, and does not have money to even buy proper food, let alone even the medicines. Now, this is a clear case of elder abuse. This couple came to my OPD with bruises which I initially thought was due to some road traffic accident. Later, when I came to know about their story, I helped them to get in touch with the appropriate medical social service officer and also made them aware of their rights under Maintenance and Welfare of Persons and Senior Citizens Act. However, they also need strong community support to be able to take legal action against their abuser and not to be discriminated in the society.
Geriatric care in India. For all those who have old and ailing parents, deciding on the appropriate care center is crucial. There are many options available in India based on the level of care to be given to geriatric patients. Number 1. Old age retirement homes. These are places where the old can come and live in a community. They are expected to be in full health, with ability to do minimal chores for themselves. They usually have canteen, where they can come together to eat. The facilities in such places are for able-bodied old citizens. There are a variety of places with services like physiotherapy, on-call doctor facilities, etc. The prices range from Rs 8,000 to 15,000 per month depending on the location and services provided, such as special meals, swimming pools, attendees, etc. They have a vibrant community, with the retirement homes arranging for festivities and regular day outs for the members. Number 2. Old age homes. These are places where the patient's partly ailing. They have on-call doctors, physiotherapists, attendees, nurses, medical equipment, etc. Food will be provided and they will be given attendants to feed, bathe and clothe and take care of ablutions. They will also be given medications regularly and have monthly visits from a variety of doctors. They have a vibrant community and aim to improve the quality of life for the aged. Number 3. Rehabilitation centers. There are few specialized rehabilitation centers in India. They are specialized for post-operative care from the minimal to the extreme cases with severe mobility disability. They aim to help the patient recover and therefore have in-house doctors, therapists, nurses and staff. These centers are cost prohibitive, Rs 50,000 and upwards, since they provide specialized care. Number 4. Palliative care. These are centers for the severely ill and dying patients suffering from cancer or AIDS, among other diseases. They have full medical facilities with in-house doctors, specialists, therapists, nurses, attendants, etc. Their aim is to manage the quality of life of the patient while providing long-term medical attention. Most palliative centers are run by NGOs and therefore they provide services for patients across the economic spectrum. Deciding where to house and care for depends on a few factors which you can consider. Number 1. Health. The decision on which caregiver is appropriate would be based on the health and amount of care to be given to the patient. You can consider the amount medical assistance and help required to perform everyday duties. Among others, consider the length of the recovery for the right choice. Number 2. Cleanliness and hygiene. Since most doctors will confirm the chances of catching something like an infection is higher in a medical facility, cleanliness and hygiene is critical. Check the beds, bathrooms, kitchen and their maintenance routine to be sure. An odor-free environment with plenty of sunshine is ideal in most cases. Number 3. Cost. Though we want to provide the safest care for the elders in our life, we have to consider the cost of rehabilitation and recovery. While the palliative centers in India are some of the most affordable in the world, the cost in an old age home can range anywhere between Rs 15,000 to 150,000 and higher per month. Most of the places also ask for donation or advance amount, which can range from Rs 20,000 to a couple of lakhs. The monthly rentals typically include accommodation and food. Number 4. Emergency services. Most of the old age homes have associations with hospitals, ambulances, clinics, etc. Depending on the health of the aged, you can choose a home that provides these services and are closest to your home. Number 5. Quality of life. The primary attention, though, is to find a loving and caring environment. Speak with the other elders housed in the facility and gather their experiences to judge the timeliness and gentleness of response from the home.
So, I end this module here now. I thank you for your patience and attention, and I hope this would have provided you some understanding of geriatric care. As I mentioned, aging is an inevitable phenomena. We all are and we will continue aging, and I wish you all a happy aging. Thank you.